Good evening, everyone, and welcome to the 340th episode of Gyan Pravah, which is the brainchild of our Fogsi president, Dr. Sunita Tandulwadkar, and it's been an out-of-the-box idea of her that has made it possible. So, throughout the year, we have been doing it every day between 8 to 9 p.m., and you can see that 365 days of the year, and we are already into the 340th episode with a few more episodes to go before we wind up. Welcome, madam. And today it's my last podcast for the year as well. And today we have Dr. Girija Wagh, who is the head of the department at the Department of Obstetrics and Gynecology at Bharati Vidyapeeth Medical College and Hospital, and we are going to discuss about women health and medical education. So before we start, I would like Dr. Sunita madam to say a few words about this.
Thank you, Chaitanya. Thank you and welcome Dr. Girija Wagh. These podcast series are very important in a very disciplined way. We all join and the way chairpersons have worked is most amazing. I'm so thankful, Chaitanya, you got Girija today. Welcome, Girija, on a Foxy platform. And every day joining, making 340 episodes is not simple, but it was possible only because of my chairpersons. Thanks to all of you. And as our protocol, I will be joining the viewers link and you both enjoy the podcast, the dialogue, and I'll enjoy listening to both of you. I hope it goes beautifully and see you on another end. Thank you.
Thank you, madam, for those kind words. And let's start with today's episode. And what we have done is in today's episode, we are having Dr. Girija Wagh, and she is going to discuss on beyond the textbook, women's health and medical education. Let me introduce Dr. Girija Wagh officially. She is the head of the department at Bharati Vidyapeeth Medical College and Bharati Hospital. And she's been a teacher par excellence. She is into medical education for last 35 years. And that's the reason why I thought of, having her today for this podcast and joining two different worlds together. That's women health and medical education. Well, this is not just about medicine, but about the society, the resilience, and the future of care. So let's begin with Dr. Girija's personal, journey. How did you start? Why did you choose to be a doctor in the first place? And how did the journey go? Let's start with that, and then I will move on to other questions which are related to medical education and women health.
Thank you so much, Chaitanya, for asking me these questions. I think they are very important for all of us to understand. But above all, I must thank Dr. Sunita Tandulwadkar for creating such a, absolutely astounding platform wherein all such people could be introduced to our Foxians and we could relate and find out from lives. And there can be no better way than trying to get into these instances, these topics, which are usually very, very important for our everyday living. Now, this has been a long time back, Chaitanya, when it was around 1983, and that time the world was much simpler than what it is today. There were no cell phones, there were only trunk calls, and then there were only two options that a person could have, becoming either a doctor or an engineer. And typically a woman could become an engineer, a doctor that was typically looked at. And we were going through schools, we were good performers. But I remember that I actually wanted to become a nuclear physicist because I was much taken after Dr. Mary Curie that time. But I remember that my father telling me sometime, just sharing while on our walks, he said that I want you to become a doctor like Madam Mehta. If you remember, Madam Mehta was a very famous surgeon and my dad was operated by her as a young man. And he said, I want you to become somebody like her. I said, let me think whether I'm able to take this. But then I started thinking on those lines. And then I realized that, yes, it's going to be very important. People like Dr. Gupte, who has been the ex-vice chancellor of Pune University. They were my dad's friends, his wife. All those people told me, that doctor's life is very tough and hard, especially for women. And you seem to be so interested in small things in your house. How are you going to be there for your patients? Think of it. And then I felt, no, this is the only best thing that I can really do. And I felt that, okay, fine, I will become a doctor. I went through the medical school. It was quite tough staying away from your home in that horrible terrain. You know how the hostels of our government medical college in BJ Medical College were. But we sailed through because of friends, because of wonderful teachers, and because of that servitude attitude which we had. I did not have any doctor in my family apart from my uncle who was a BMS doctor. But then I wanted to, so therefore it was more stressful because it was more competitive because you wanted to prove yourself because you knew that there was nobody backup and there you had to be with your patients, with your teachers, with your friends, and many of our friends actually help us to sail through these challenging times there. It so happened that I became an intern doctor in the St. Luke's Hospital in Shrampur, and I found that I've had a liking towards surgery primarily. But there I realized that surgery is too complex. I saw so many patients undergoing AP resection and such confusing anatomy. And then on one particular day, I happened to be a part of multiple births which happened because everybody in that particular place had gone to play cricket, to see the cricket match in Pune. So I was supposed to be handling everything there. And then I realized, oh, wow, let me become a gynecologist. It's much more limited. It's a surgery. Most of them are normal. And then I called my father and I said, Dad, I think I'll become not Mehta madam, but I'll try to become something like Banu Koyaji. Is that okay for you? That's how I chose to become a gynecologist.
But then, when you decided to become a gynecologist, well, private practice has been lucrative always as compared to the teaching profession. We always say, or we always respected the teaching profession as a noble profession. And still, there are very few who choose that as a career on their own. I mean, with due respect to all the teachers who are listening to this, but there are very few who choose it as on their own. What made you choose uh, medical education or being a teacher or a professor lifelong over
Too many years.
having private practice?
The moment you say that it is 34 years, then they will all come to know my age.
So
Because
I
the
haven't.
moment you say,
That's why I have not said the the years. But then we all know that you have been there for so long.
okay, so basically, what happened is when I was doing my gynecology itself, it was on my dad's mind a lot that I must get into public service. That was actually on his mind, that I must get into public services. And we found that going through medicine would be a great idea.
Okay.
But while I was doing my post graduation and I happened to get into nuptials, and I also was carrying my son that time. And towards the end, I delivered. So after I finished my MD, I delivered after 2 months. And then I felt that it's important that I get into a protective environment rather than continue to be in a government service that time. The reason also was that time the government post used to be every monthly positioning. You will not get it so easily. You had to apply every month, and I did not want that kind of an sort of an uncertainty.
Security.
And I wanted safe environments for my child because he was a small little baby. And at that time, it so happened that Dr. Patang Rao Kadam decided to start Bharati Vidyapit University Medical College. It already started. And Professor Shivaji Rao Kadam, who is the Honorable Chancellor currently of the Pune, of the Bharati Vidyapit, he called my father and he said, why can't she join us? Because she has topped, she's a gold medalist. We want people like her to join us. And therefore, it was sort of a home invitation. And I got into there as a temporary arrangement. But as I got in there, I realized that while I was there was always this stiff, we always used to feel in the beginning that these are the students who are coming, who are moneyed. They did not get into the government, and that's why they are here. But all those previous batches, which I trained and tutored and came in contact with, all these students were brilliant students who did not get opportunity just because there were not enough government seats. And therefore, I got into that dynamism of what the Bharati Vidyapit happens to be. And I felt this is wonderful. because I could reach out to patients through mentoring in a bigger way than anything else. And of course, it was a very meager salary. As you said, private practice, I was constantly flirting with an idea of getting into a private practice. But then this idea never came by that I have to leave Bharati Vidyapeeth. Private practice came to me parallelly as we went ahead when I started getting promotions, and they gave us privileges to have our own private practice, which was very nice. Because as a teacher then, I got an exposure not only being an academician, but also a private clinician, which was extremely important as it used to be a setting we used to have in Sassoon Hospital for our honorary professors. If you remember, we used to look at it for a different experience. कि actually population में जाके क्या होने वाला है. So I felt that that was a wonderful opportunity. And then secondly, I think it's very much in my genes because my father is a professor. He was a scientist.
Exactly. That's what I was going to ask. That
Yeah,
was
and
it
therefore I think
his mentoring or his
yeah,
upbringing that
somehow, yes.
also backed that instinct of being into teaching, because
Yeah,
he
being a
himself has been a
master
teacher
was, I felt, you know,
all of his
as we
life.
call it, being a master is something that I felt. And it was not easy that time, Chaitanya, because in Pune, there was a lot of aversion towards Bharati Vidyapeeth. Everybody used to feel कि सब ऐसे जिनको कहीं नहीं मिला, those are the people who are getting there. They are less experienced. They are experimenting on patients. But I think over a period of time, we have proved ourselves that yes, we are an excellent institution. We are great teachers. We have mentored so many students, and our alumni are doing extremely well. So sometimes patience pays. I'm very proud of myself that I stuck to that and I didn't venture into various kind of things. But I'm happy the decision that I took, and I feel that is the best tribute that I can give to my dad and to Patang Raoji Kadam, because I always believed in what he said. You know, it requires a lot of courage to start such a big education where there is nothing. And I can see over a period of decades, now I have been associated with them for 3 decades, there has always been a progressive change which is magnanimous in its presence.
Okay. Taking a clue from that, I just want to, discuss in this second, what you can say, session or topic of this about the integrity of the medical education, which has been. Now, you have been there in this field for the last 3 decades. How do you see the evolution of medical education? And when I say, or when I ask that question, I would like to know from you both the good things what has happened to the medical education, as well as the bad things that has happened to the medical education, and what you would like to how would you like to balance those two things?
Yeah. So basically, I'll tell you something that medical education is an extremely important component of our literacy. We need doctors. And not only we need doctors, we need excellent doctors. And this is something which absolutely is a dogma. It's a black line on a, this on a white line on a black stone, which cannot change. And to achieve that level of medical education and expertise, we require to really have that kind of an approach towards it. Now, what had happened in the past when I was training, and probably after me, you were training, you are a few years younger to me, things were similar. Like for you and me, the things were similar because it was something like a legacy which came from our teachers. It was something like a commitment which came from the students. And it was something that was part of our parenting where they trusted us with the system and the parents and everything. And they said, it's your ball game. And it's you who has to take the decision and the calls.
Yeah.
So we went there. We were youngsters, but we were committed. But we had strong emotionality, probably because of our upbringing. We came from a very simple background, and therefore our expectations were less. We did not have so much of information overload, so we were less confused. And plus, we had followers. Our little hands were holding to the fingers of those strong men and women who were our teachers. And they were giving us knowledge absolutely unrestricted. And we believed in them because that belief was the only single most core of that education and understanding. We trusted them. They trusted us. And it was never questioned. It was never doubted. Now, what happened later on? For the need of having an expanse and a uniform medical education, towards the end of my post-graduation, I saw that there was a absolute entire national level entrance exam which was conducted.
Yes.
So previously, while I was taking admission for post-graduation, it was only my state. I would take admission in the state. If I don't get in the state, then I will go maybe give a capitation fee and take it outside if I can afford it.
Okay.
While what happened now,
So all India entrance exams were not there at that time.
not there. We were sitting like a batch in BJ Medical College and deciding tu pediatrics karega, tu medicine karegi, tu gynec karega, tu ortho karega. Simple. And then we would go outside. Now the entrance came when I was in my final year as CR, and then I had students who were coming from all different parts. And just imagine what happened was, it was very difficult for those to adjust to the society. The language barriers, food barriers, and they were never going to stay in that same state. They're going to go back. But many of them were going to stay in your own state as well. But what happened was, they could not connect that legacy which happened because of the same state. While you're looking at the entire political scenario, or let's look at the administrative scenario, health is a state issue, right?
Yeah.
Health, but then how can medical education become a national issue?
Okay.
But that was an attempt which the government was trying to make, because there has to be uniformity in training and we have to make good doctors. That was the purpose.
True.
But unfortunately, I feel it did not really see the correct light of the day. And therefore, many dropouts happened. People could not adjust. And therefore, we lost that bus. Now, later on, what happened is, recently, what has happened is, I have nothing against private medical institutions, because I'm one of the drivers of one of the institutions. And I feel that it is offering opportunities for students who missed it through the government. And they are doing a good service also. As long as they are doing good service, they are following the dogmas laid down by the NMC. They are following everything in the rules and regulations of the CBAB curriculum. Then they are wonderful. There's nothing wrong about it. But the NEET examination has come in. Now, this NEET examination, is it really a foolproof way of assessing the student's intelligence? Can you give us confidence that there is no pilferage in the conduct of that examination? These questions are really troubling us a lot. And just look at a young person. Let's look at a young boy or a girl who has passed the 12th standard now, and then has done the NEET entrance examination, couldn't clear it. See, after you pass your MBBS, you're supposed to do internship. What is the purpose of your internship? That you are supposed to practice whatever you studied in the theory in your patients. You're supposed to get clinical exposure. You're supposed to see, can I speak properly? Can I communicate properly? Can I do those small things? Can I witness things? Can I be part of patient care? But you are busy doing your NEET entrance exam.
Absolutely.
You don't have time to do that internship. I, as an intern doctor, was looking after 20 to 50 antenatal patients in a day in the OPD. There was one operation theater which was given to me, where I will do, small surgeries along with my other co-interns. ये अपने interns को अभी नहीं मिलता exposure, because they have to pass that NEET exam. Their mind and orientation has become towards MCQs, towards small those SAQs, LAQs, but then half of that exam is clinical based. Unless and until you have a clinical exposure, how are you going to be able to answer that? And now, if you are not able to clear, not able to get the institution that you want, they keep on going through that entrance. So now just see, the student is appeared 3 times, 4 times. How many years of the young life has gone waste? Are you understanding? The youth, that person who is at the prime of his performance, who will be there as a wonderful field worker to deal with emergencies in patient care, is sitting at home and writing his exam on the table.
True.
Is that right? Aren't we losing on something very important?
True.
So we have to find out a way, and I'm sorry, I have no solutions. I can only raise questions at this point in time, because I know you're going to tell me, then what is the solution? So I'm before that only telling you that I don't have any
But until unless the questions are raised, we may not, start looking for answers. So if That's the reason asking questions is also equally important. As you rightly said, we may not be in a position to answer those questions right now, but at least that can, start the discussion or start the conversation, and on which um, in future maybe we will have the answers.
Correct.
Well, uh, what do you think is the importance of integrity, mentorship, and values in shaping these future doctors? Now, because there's again, as you rightly said, we were looking up to our teachers like mentors. They were guiding us in each and every step. We didn't
Correct.
have much of access to the information which these young doctors nowadays have, and therefore we relied upon our teachers completely for the information, for the knowledge, for the experience, everything. Now the scenario has changed. Do you think that also has led to a little bit of change in attitude or approach from the teacher's side as well?
Yes, yes, it has changed. And I didn't realize whether it had changed, but then recently we had students who had taken admission in Bharati Vidyapit in 2000 coming for their 25th
Reunion.
anniversary of a reunion.
Yeah.
And at that time they were talking to us, and then I called those who became gynecologists to my department, and my residents and the juniors were aghast to see how personally we were connected to them. They knew
Okay.
everything about us and we knew everything about them.
Mm.
But today that has not happened because we are very, very concerned. Like the students were asking me, Madam, what has changed? I said, I've changed. My P's and Q's have changed. I'm very
Okay.
careful when I say anything.
Mm.
I weigh when I speak. When I was with you, I was myself. I was just myself. I
Mm.
was sure that I will not be criticized, I will not be judged, and my intentions would not be wrongly construed. Which fear I have today, I'm not
Right.
sure
Right.
whether I'll be
You
understood
may
well.
not speak from your heart today.
Yeah, so I have to be very careful when I talk because I really do not know how much is the emotional quotient of the person to whom I'm talking. There's a
Mm.
whole lot of emotional fragility which has come up now.
Yeah.
They are not as strong as they used to be, as we used to be. And I think we can't blame the situation. We have to change. We have to, as a teacher, what I realized is I have to change. And I have to adapt to this situation. And it's very important now that we have to objectively tell these things to them. Like you said about integrity, you said about attitude, you said about ethics, all these important things. Attitude is very important. Like I remember sometimes there used to be batches and they used to say, Madam, we are not going to go to the labor room. Those women, there's so much shouting and it's so bad and so terrible. But what are you expecting? You expect a celebrity to come there and deliver in your labor room? You know, that is going to be a presentation of pain. You have to learn as a doctor how pain is, how labor happens. So this is the change. Are you seeing that I would rather not get into problems which are hurting, which are
True.
problematic? It's probably that they're scared. It's probably that they can't stand it. I have so many students who have told me that, you know, sometimes when there's too much of noise, we are not able to deal with it. There are
Okay.
so many students who have relationship issues because this is a changing society, right?
Yeah.
And I, as a teacher, want to be there for them. But unfortunately, I'm seeing that there is too much of demands. There's too much there which is asking me to do things. And
Yeah.
then in my limited capacity, it becomes difficult. And therefore, we have to take help and assistance from various ways in which we can reach out to the students so that we are able to give them the correct answer. Now, I'll talk to you about training a little, which I want to draw a parallel. Sometime back, when I was in Germany for training for my endoscopy and infertility, I remember in that university that while I was immediately exposed after I became MD, I was immediately given a post of lecturer. Then, with a few years of experience, I could become an assistant professor or an associate professor, and then I can become a professor. It wasn't so easy in that university where I was training.
Okay.
After they had to go through a lot of rigors, they had to go through a lot of training. And then to become an associate professor and then a professor required a lot of publications, lot of performance assessments and criticism, and then only they could become. And probably we are now going on that line. So if you decide to equate it to what we were going through at our times when we quickly became consultants, Now we will have to give some time to the youngsters because they will have to achieve those kind of skills, publications, and then that kind of privileges, because skill sets don't come now. You remember that we can't just go and I can operate cancer, but I just can't go and operate cancer. There has to be somebody who is deft in doing cancer. We all know this. This has come up with a purpose, and therefore we have to all be understanding these things and not really run it down. Not only go into this typical jargon ki hamare waqt bahut acha tha. There were good things at our times, but there are certain good things even now.
True.
But it's very important that we understand and we become a little stronger human beings, is what a message I really want to give everybody. Because emotional fragility everywhere and anywhere is not going to take us anywhere.
Yeah, that's true. And there are so many good things that has happened because of the advances in the technology and so on and so forth. Because I see my children being on the 3D views and simulators and all that. So have you integrated all these technologies in your teaching methods or teaching ways? And has that helped them to understand the subject better? Do you think that the understanding of the subject, for example, the anatomy, the physiology. Now I know that we used to have one a body for say 10 to 12 students, and all of them used to stand around the dissection table, and then only a few of them would be in the front, many of them would be in the back trying to have a glimpse of what the dissection has been done, and trying to remember that anatomy and then again write it in the papers. Compared to that, now these people have simulators, these people have 3D views or videos which they can run through again and again. And has that helped them to understand the anatomy, physiology better, or understanding of the medical education itself has changed because of all these things?
Yeah, the knife cuts both ways. Okay. Now, one thing is technology has helped tremendously. One thing has happened in the recent past is the National Medical Board has come up with an insistence that all medical schools follow the CEB-ME pattern, which keeps on getting revised nearly every year in the teaching methodology. So while we are teaching students, we have to adopt this newer methodology, which is called as competency-based medical education. So herein, now you have a topic, for example, to teach them today. And you're going to talk to them about diagnosis of pregnancy. So you're not just going to go there in a clinic and sit and talk. You have to make a lesson plan. You are going to utilize those 3 hours with a purpose, wherein you are going to plan. First, you are going to give them the basic knowledge. Then you are going to give them case situations. And then you make them answer those questions. So like, for example, the other day I conducted such a class. So I divided the batch into 4 groups. Each one of them was given a case. And then they were supposed to study, think about it for 10 minutes, and then present it to me.
Okay.
Some of them were made to enact also. Like one of them was a pregnant woman. So communication, knowledge, test, investigation, everything was done. And then after that, I took them to the outpatient department and showed them, now let's see how we are actually doing a diagnosis on a woman who has come for consultation. So this has always been there, but it was sort of, we are being a little more theoretical in the middle, and the NMC came with making us understand again. That's very important that and this has made, I feel life is much easier. Only thing is I have to think and plan a little, which takes about 5 to 10 minutes to plan each lesson. But this way, the students are participating.
Sure.
And now there is something called as an open book exam also. So we want the children to go to the textbooks. Otherwise, they are on their iPad and ChatGPT.
Yeah.
So we give them questions and we give them a textbook and we say, now open the book and write the answers.
Sure.
So today, when you
the change that I have found, my daughter, who happens to be in your college, she takes her iPad.
Yeah.
I mean, and on the first day when we went and we had a parent-teacher meeting, the parents told that it's fine even if your pupil comes with an iPad or an electronic writing book, and she writes in that instead of having a notebook and writing with a pen and pencil. I mean, I was taken aback, where are we heading? And well, you have to keep with time and
Absolutely.
change with time.
So I've become an expert teacher using the whiteboard on the smart boards. We have smart boards in all our classes. So we have to also improvise on our teaching technology. Otherwise, the students will not listen to you. Look at your own children. I
Yeah.
always tell my own sons that I'm going to be always be one step ahead of you in technology and everything. Otherwise, you will write me down. You'll say, "Mummy ko kuch nahi aata." So it's likewise for students also. So you have, now what has happened is we have simulators. We have an excellent simulation lab. So we have a Lucia, who is a mannequin, which is a very high grade mannequin. And she is the one who delivers, she groans. We can teach baby births on that. There is a absolute, a big kind of, and a computer, which has 4 or 5 bodies dissections, which are fed into it. So if I want to teach students an ovarian tumor, I just tell them this is the ovarian anatomy, where it will go, what it will happen, and then I actually teach them on a case. So we don't have to imagine too much. But I feel, as I told you, the sword cuts 2 ways. I feel 2 things are lacking. One is sometimes students will feel कि ये तो क्या मैं YouTube पे देख लूंगा. Madam के recorded lectures देखूंगा. What is there to go in there and get into interaction?
That's happening.
That's
That's
happening.
already happening.
Yes. And the second thing is, this is definitely giving rise to cognitive deficit.
Okay.
You remember what you
Can
did?
you elaborate? Can you elaborate on
So
that?
you said that I had to imagine anatomy. I read it in the book. And then after I imagined, I put it across for my teacher to understand that I have understood, or I put it across while I was doing my surgery.
Right.
You were always
Thinking.
fondly imagining things. You were going into 3-dimensional association.
Yeah.
While the pictures for you were only 2D,
2D.
you were learning, and that cognition helped you to imagine where is the uterine artery? How is it coming as a branch of the anterior interior iliac? When
True.
you're just looking at the picture, you're not thinking, you're saying, हाँ बहुत आसान दिख रहा है ये जा रहा है यहाँ से. But you are imagining, and therefore probably I felt that cognitive deficit is a problem, where they are not spending time in cognition. And therefore, then most of them will be taken away from surgical fields. They will find the easier way outs rather than getting into this hodgepodge. But I feel as a teacher, I should nurture all kind of interests, and I should always try to encourage them to find their best way forwards. And I must always make them emulate. So as a teacher, it's your responsibility that you're constantly there trying to show them what is good, what can be done, the maximum of everything, so that they have some role model to see कि नहीं ये मैं भी कर सकती हूँ. You understand?
Instead of getting fearful about it,
Absolutely.
one should start loving it as a subject.
Yeah, you must be able to adopt it. You must be able to accept it.
That's true. That's true. So there are changing medical issues which we have seen in women as well over a period of time, as the lifestyle changed, as the way we work, the way we eat, the way we exercise or sleep has changed. That itself has led to different set of medical issues in women. Now, should the medical education be also adaptive to these shifts with more emphasis on these changing trends in women health in particular, and as a whole as well? So what are your thoughts on that? And is the medical education keeping pace with these things?
Yeah, now medical education is just definitely trying to keep pace with all these kind of things. One thing is, I told you that they have inculcated various dimensions to teaching. We are having nutrition, we are having counseling as a part of this. We are going to also be inculcating some more counseling pertaining to every specific arena. There probably is a proposition that we should also speak about economics and health economics, which has to be a part of this. There has to be not only that typical PSM, but a lot of preventive things where we have to speak about whatever is available. So it is definitely evolving and is all encompassing. However, as I mentioned, that it always also depends on the individuals. We as doctors, you as a parent, I as a clinician, all of us matter. It
Yeah.
cannot be that somebody else is going to do it. I
Yes.
have started with me. I have to do it, and I have to ensure that this is given, because whenever we are speaking to patients about preventive healthcare, wherever we get opportunities. Today, I remember one patient coming to my clinic and she telling my nurse, "No, don't please put me on the weighing scale, because I know my weight is very, and I don't want to be body shamed." So they don't
Yeah.
want to be body shamed.
Mm.
So you have to be very careful. So this is part of your communication,
Yeah.
part of understanding that patient empathetically. We are absolutely right when we are saying that your weight is so much, the weight is causing problem, but we have to also understand that the patient will not like it. And then whenever you have said something which is negative, it's important that you are giving her a solution. You're being careful while you're talking about it. Sometimes when we are too knowledgeable, we may come out a little more, and this has happened to me a lot of time. I'm very assertive. I'm very dogmatic. Sometimes I say things with a lot of assertion, and the patients and many of my students or my colleagues misconstrue it that I'm being dogmatic. हाँ बहुत strict है, बहुत strict है, बहुत कड़क है. So we have to learn, and I'm also on a learning path. I'm still learning how to be a better communicator, because finally, na Chaitanya, you are the best person to deliver that particular service and goods. And if you are not able to reach out to your patient, then you have failed. I always tell my students that you will become a good doctor only when you have a patient sitting in front of you. You cannot be a good doctor just wearing your apron and stethoscope and your degrees, if there is
True.
no patient sitting in front of you.
True. True.
So then all this means that all these things have to be brought together. There is no replacement to knowledge. There is no replacement to skills. There is no replacement to empathy. There is no replacement to awareness. There is no replacement to education. Educating the patients as well is our responsibility. But at the same time, we also have to be on the pulse of the society, because our society also requires a lot of churning. We are all suffering because of this. We are seeing that sometimes patients are not really taking the communications properly.
Yeah.
That's again the emotional fragility that I spoke about. Everybody's become very sensitive. They become confused because of information overload. इनमें से सब में से negotiate करके we have to be on that path. So if you ask me what were my teachers' struggles and what were my mother's struggles, their struggles are completely, my struggles are completely different and modern than their struggles.
Yeah. But then, as you said, that there is importance of teaching this communication ethics and emotional intelligence to our students. Has it been a part of the curriculum
Yes.
today?
Yeah. There is one curriculum which has been proposed by CBME, which we used to make a lot of fun, but now we are becoming experts in delivering it wonderfully to the students, and that's called as the ETCOM module. So this is a short form of attitude, ethics, and COM communication.
Okay.
So in every aspect of learning, in every fraternity, in every surgery, we teach them about this. Not only they are supposed to write a logbook, and they are supposed to write a reflection. Now, for example, today I took an ETCOM module for the 8th semester students.
Okay.
So in that, I taught them everything about beneficence, benevolence, consent, empathy, limitations of a doctor, everything, ethics, communication, everything we discussed. And then I gave them 3 cases. And after that, I made them write a reflection as well. And the reflection was on professionalism.
Okay.
So they're supposed to write for 5 to 7 minutes the reflection, what professionalism means to them. And then we discuss and have. So I am enjoying this type of teaching because I am liking it, because students are participating. I'm making them speak, talk. I'm learning from them. And I feel when it is participatory, then it is more absorbing. And they will feel more and more to go and do better things, because I know at the end of the sessions, they have a lot of questions to ask me. And that's so nice. Otherwise, they'll keep quiet looking at your PowerPoint presentation, half of them dozing like that and go off. That's not right.
And because these things were never taught to us, we used to, see, listen, and to our teachers or mentors, and based on that, we developed our communication skills. So if we luckily had a teacher who had a very good communication skills, and he or she gave us or taught us the importance of that, then we would have a similar kind of communication skills. But it was never like a part of the curriculum, and therefore I feel, yeah, that's a very good step towards improving the communication, because at the heart of most of the disputes or issues when it comes to patient-doctor relationship is because of the lack of communication, because of the lack of empathy towards that patient. And if these doctors who are coming out from the medical schools know about this communication and ethics and emotional intelligence or empathy, that would be great to reduce the friction between the patient and the doctor, isn't it? So one thing what I feel that they should be able to see that patient as a person rather than just a patient, a holistic approach which needs to be an integral part of our management or treatment modality when it comes to the treatment of the patient. Well, I wanted to go into a little depth about the students, the psyche of the students. Has it changed over time? Do you see that the the self-esteem or the trust, or there is lack of something because of the change in the family structure? Nowadays we have a nuclear family, both of them are working, so most of the times the kids are alone at home, and that's how their upbringing have been. Have you seen the change in the approach or attitude of the students, and
Yes.
how do you deal with that? Because you cannot just go and shout at them, because you don't know how that person is going to take it, which was not the case when we were
Yeah.
brought up.
So yeah, typically what has happened is there is a lot of self-doubt that the children face because it must be coming from the parents, it must be coming from us as teachers. So sometimes when there is such a session, now I'm talking about myself quite a lot, but if anybody asks me, Madam, what about you? I usually tell them that it's better that you do not emulate what I went through because it is very difficult, and probably that was a time when I could not say no. But now you have a choice to make your choices, but then make those choices rationally. For example, now one of my junior colleagues came to tell me that, Madam, see, one of the patients, the patient was fully dilated, but the resident doctor said, my duty is over, I'm going. We would never be able to tolerate. Even you will not agree to this.
Absolutely.
But then that's how it
I
is.
just thought, how can that person say like that?
But it happened. So they know exactly what are their responsibilities and roles. They know their rights. They know their responsibilities. So we have to be very careful. They exactly know how to interpret what is written on the NMC guideline. So if you have told them that 8 o'clock you can go home, they will go home, come what may. So that is the difference. I think it explains. I would not like to make any comment on that. But all the same, you can make that difference. But we have to go into acceptance. We cannot judge that person. We can just say that, okay, she has the, the ability to say no and walk off.
Yeah.
While I would have like a stupid fool that my junior was saying, I would have never walked off, madam. I would have been there. But so that's the difference that has happened, which we have to learn to acknowledge. And therefore, what has happened is they have become less stronger. And there is one typical syndrome, which is called as an imposter syndrome that has happened, wherein they're constantly in self-doubt. They're constantly having a low self-worth. They're constantly, because now if you act like this, who will appreciate you?
True.
No one will appreciate.
No.
But if at all anybody wants to appreciate you, for example, Mala, I just want to say, I just want to appease to Chaitanya. Though I said, Chaitanya, you were so great, you were so good. You are also understanding that yes, shayad false bol rahi hai. It's not coming genuinely. And then that self-doubt further increases. So truthful criticism is something that our generation grew on. In fact, we were looking for that criticism. You and I have delivered so many talks. When we come down from the stage, We have seen that half of those people were actually not even listening to your talk, but they say, wow, what a talk you delivered. But there will be somebody else, and I have always had Dr. Usha Krishnan, Dr. R.P. Sunawala, Hema Divakar coming to, no, Girija, the talk was excellent, but this was a thing which you should have done differently. This was something that you should, those are your real people who are going to really tell you what is the truth.
True.
And we have the courage to take it. The current generation, that imposter syndrome people are very weak. So we will have to gradually train them, teach them, try to make them understand. And therefore, this reflection, diary, introspection, participative learning is definitely, I feel, is going to help them. Most likely. That's what I feel. I'm very hopeful always. I am a very positive person.
What are the challenges what you see in women today, health challenges in women today, which were not a part of when you were growing up? And do you see that there is a way that we can, change the scenario again?
See, the problem is, even if the women have got into workforce, the understanding and the social dynamics or the family dynamics haven't changed by and large.
Yeah.
So women have to be, they are overworked and overburdened. I'm sorry to say this. This is happening by and large. Of course, there are some women who have been able to make the equity equations in their families, but there are a few handfuls of them.
True.
But while we are getting into these equity equations at the one time, which is one of the most important things, which I always believe will make a lot of differences, we have to inculcate good nutritional practices. Unfortunately, we are going haywire there. Youngsters, when they come to take admission in medical school, they are looking absolutely fresh, freshly come from home. And in the first year's stress, the hostel food, or they are probably not taking the hostel food, they're taking food from outside, eating a lot of junk foods. By the time they come to second year, to the clinical part, we see they're bloated up, they've started becoming hirsute, they have become obese. All these things I'm seeing. Same is happening even to the boys. Now the health, the environment, the stress is definitely taking a toll. And the only way in which it can be combated is by having excellent nutritional practices and excellent physical activity habits inculcated from the day go. Because we cannot deny our Asian ethnicity, the genes from which we have come up. And if we have to modify all these problems, we require to be there preventing from these small basic things. For you and me, we are typically Maharashtrian, taking simple sattvic food. Nothing went wrong with us.
True.
But just imagine if I am in Hyderabad and I'm keeping on eating biryani every day, what will happen to my metabolism? ऐसा उनके साथ भी कुछ हो रहा है. You understand? So I feel this is making a lot of difference. The age of everything is changing. Unfortunately, couple dynamics are becoming very bad. I'm very sad about it. Very rarely we see that couple is really genuinely liking each other, has love for each other, has respect for each other. There are so many other aspects which have come into relationships.
But then
why?
There's not much time also they have for each other.
Yeah.
That's the problem. So you need to have time to understand each other, and then you can love each other. But it's hardly any time that they spend together, because both of them are working, have got their stresses at the workplace.
Yeah.
And it becomes very difficult. Yeah. So let's talk about the future. What reforms you would like to see in medical education? In what way? And maybe if you can give a few options that can be implemented to see those reforms actually being true or in existence.
See, now what we are talking about is where we are heading towards creating uniform medical education across the country. That is one of the basic aims and objectives, so that we get equitable opportunities and we are able to deliver wonderful skilled care and education. Now, if it is so, when the NMC is throwing these programs to us, ki tum ye karo, why don't we also sit together and design those programs so that they can be uniformly delivered everywhere? Are you understanding? There is some part of the education, like if you are creating particular modules, let them be those modules so that everybody gets delivered the same modules, so that we have uniform education. Why each institution has to experiment and create?
But unfortunately, there is no equitable situation throughout the country. And that's the reason why some of them have gone ahead and some of them are left behind. So even
Lacking.
if so even if you have those modules and if you want to have them implemented at the national level, it may not be the case because the facilities, infrastructure, the human people, the personnel who are there may not be of equitable equations.
Then why can't we have an exchange education? That's another thing I'm coming to.
Yeah.
Like if I am a teacher in a private school, but this is the same student who is going to get trained under the NMC dogma. So why doesn't he have an exchange studentship through maybe the government facility, which is very busy, and they get exposure to our high-tech facility, which is offering all kinds of training in a systematic fashion.
Yeah.
This can be second thing, integrating and exchanging.
Yeah, that's
Rather than going abroad, let's exchange within here, inside the country.
Yeah.
Now, if an engineering student decides that he doesn't want to continue the mechanical engineering and he doesn't want to continue that institution, he can very quickly shift to another institution, whether private, government, whatever. Medical can't.
Medical can't. True.
We can't do that.
Because there are economics which are involved in that. Probably that's the reason why it's a little difficult.
I think we are very smart and strategic. We can always work around it.
That's true. That's true. Well, what do you think that how can we prioritize women health issues in our curriculum going ahead?
See, I will always want to remember this, that every part and every fraternity and every place, wherever we are teaching them, we have to speak about women's health in all contexts, because it's finally going to be a woman who is going to be driving the health dynamics of any country.
Yes.
And therefore, this understanding is very important, because I get an opportunity every year to speak to intern doctors who pass out from our institution. And I teach them this, that you have to be very careful whenever you're dealing. My topic of my talk is your female patient. Ye topic hai. I speak on 45 minutes. Tell them why it's important that you be sensitive to these women's health issues. Because they are performing a very important function of reproduction. And there are a lot of things around that reproduction which bother them. Yeah. So once you start understanding women's health issue from all aspects, for example, I'll tell you a comparison. There is a man whose blood pressure is 150 by 90, and there's a woman whose blood pressure is 150 by 90. The man immediately will receive treatment with antihypertensives, low dose aspirin, whatnots. Well, the woman will be told, let's see, and maybe she'll never turn to practice, turn up again. And she'll come back maybe with a stroke or a myocardial infarction. This is happening in practice. This understanding and eligibility towards women's health is not there. We are only talking to them about infertility, abortions, menstrual health, prevention of cancer, and maybe, trying to deal with those cancers if they happen to them. But if you start talking about prevention from the beginning, if you really educate women, if you empower women with good health, the health dynamics of the entire country will change for the good.
True. Sensitizing people regarding the importance of women health and how it's at the center of the what you can say of the country's development and growth. That's something which needs to be a part of the curriculum.
Adolescent healthcare. Now just imagine adolescent women. Where are they supposed to go? कहाँ जाना है उन्होंने? They can't go to the pediatrics, they can't come to the gynec, therefore, and then the government has written on a piece of paper a lot of things and plans about adolescent healthcare. But is it really getting implemented?
Not implemented yet. True. So as a medical teacher, what is the vision for next generation of doctors? What do you see these doctors to be like? And what message you would like to give these young doctors?
I think I've already spoken that, but I'm reiterating it again. First and foremost, never forget one fact that only 1% of the entire human population gets an opportunity to become a doctor. So you are a very special person because you got an insight into getting into the human body, mind, and then delivering the deliverables and try to make changes to what God has created. So you are very lucky and fortunate. That's point number one. Point number two is that you have to be absolutely perfect with your knowledge, because this is something, any kind of faltering is actually non-negotiable. And so you have to be absolutely perfect in what you're delivering. So your skill set, your knowledge base has to be wonderful. Understand your limitations. Don't try to do things which you cannot do. Fourth, be extremely empowered with ethics, integrity, and communication skills. You have to emanate a good personality. Many people ask me, why are you always constantly dressed up? I said, I want to attract all my other students, colleagues to become gynecologists like me. Because I feel they should not feel to be gynecologist means she's always tired and sitting in Lycra and meconium.
Yeah, that's true.
And
That's
then
true.
as a doctor, you can make a whole lot of change to this community. You have to bring in a lot of research. You have to have an inquisitive mind. And you are the most blessed human being in this entire world. Never forget. So never have a low self-esteem, never go into self-doubt. Be there always for yourself, your family, your community, and your patients. Because you are the best human being who has been blessed to become a doctor in this world.
Beautiful. And then that we are the only people who can treat or manage or change lives of so many, or touch lives of so many people in one lifetime. Otherwise, it's very difficult. Though I always say that teacher is another person who touches lives of so many students throughout his or her life. And my father is also a teacher, and he always says that if you subtract the students from a life of a teacher, what remains is a big zero.
Yeah, true.
That's what his teaching has been. It's wonderful, being in conversation with you for last almost 50 minutes.
Oh, wow.
We crossed 50 minutes when we were discussing all these things. But we have a wonderful discussion on beyond the textbook, how women's health and medical education can come together or bridge the gap between the two, and how reforms in the medical education can help the society at large. Thank you so much, Dr. Girija.
Thank you. Thanks for the wonderful opportunity and giving me an audience. I'm so happy to be able
Absolutely.
to say out things which I always love to speak about.
Thank you so much.
Thank you, Chaitanya.
Looking forward. Yeah.
Yeah, bye.